So acute appendicitis is simply an inflammation of the vermiform appendix, which can be due to some worms, tumors, systemic infections, and some enlarged lymphoid tissues. So acute appendicitis can be characterized by pain in the McBurney's area. You know that the vermiform appendix has no function, especially in human beings. However, it is located in the right lower quadrant. The specific area where you can find the location of the vermiform appendix is called McBurney's area. So whenever someone is experiencing pain on the McBurney's area, the first diagnostic differential which is thought of is acute appendicitis. What are some of the possible causes of acute appendicitis? We've already discussed that it can be some worms or some parasites. It can be some systemic infections. It can be some fecal impaction. So any obstruction to the entry inside the appendix, it can cause it can cause inflammation of the appendix. For example, it can be direct trauma. It can be some tumors. It can be inflammatory bowel disease. So all these kinds of things might cause acute appendicitis, and especially enlarged lymphoid tissue. So if you've seen, majority of these causes that we are talking about are causing acute appendicitis because of causing obstruction to the appendix. And when there is obstruction, it will start swelling up. When it enlarges, inflammation is induced, and later on you should start thinking of the possibilities of the appendix to rupture. And know that when it ruptures, it can cause quite a lot of serious complications. And you don't want that to happen, because once it ruptures, definitely it's going to lead to some serious septicemia, peritonitis, and inflammation of other vital organs in the abdomen. So you wouldn't risk it to rupture. That is why we're saying it is a surgical emergency. Immediately you make a diagnosis of acute appendicitis, you need to think of performing an emergent appendectomy. Very important. What are some of the clinical presentations of acute appendicitis? We have rebound pain. Okay, when we talk of rebound pain, we are talking about pain in which when you touch the McBurney's region, it stops paining. But when you let go, that's when it begins to pain. So that is what is called rebound pain. We also have abdominal tenderness. That is pain when you are palpating the abdomen. We also have Rovissing sign. What is Rovissing sign? So Rovissing sign is simply pain on the McBurney's region upon palpation of the left lower quadrant. That is what is called Rovissing sign. Rovissing sign is pain on the McBurney's region upon palpation of the left lower quadrant. That is Rovissing sign. What about psoas sign? Psoas sign is simply pain on the McBurney's region when you flex the right leg. So when you flex the right knee and then someone feels pain on the McBurney's region, that is what is called a positive psoas sign. We also have a positive cough sign, which is also known as Murphy's sign. Okay, so a positive cough sign is pain on the McBurney's region when someone is coughing. So you tell the patient to cough, and whenever you elicit pain on the McBurney's region, just know that you are talking about a positive cough sign. We also have what is called obturator sign. Obturator sign is simply pain on the McBurney's region upon rotation of the right leg. So you rotate the right leg, someone has pain on the McBurney's region, just know that that is obturator sign. Very good. Very good. So at this particular time, we have made the revision of acute appendicitis, we have made a revision of peritonitis, we've made a revision of ectopic pregnancy. We need to forge ahead to discuss as many conditions as we can. Stay blessed.